I'm Randall Mize, and this is my head to toe assessment video for the fall semester of 2025 in advanced health assessment. Today's date is October the 26th of 2025. Here is my room scan. Table. Floor. Ceiling. All right. This is my patient Lee. Off camera, I have introduced myself and done hand hygiene. We also did a full skin assessment for patient privacy. Assessed the skin of the head, face, neck, anterior chest, posterior chest, abdomen, upper extremities, and lower extremities. Assessed for color, temperature, moisture, texture, edema, turgor, bruising, scarring, lesions, and nevi. We're going to inspect the head for midline, position, symmetry, and shape. We're going to inspect and palpate the scalp and head for hair distribution, hair color, hair texture, any lesions, masses, tenderness, depressions, or infestations. We're going to palpate the temporal arteries for tenderness. We're going to palpate the lymph nodes, which are going to be the pre-auricular, post-auricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, posterior cervical, and supraclavicular. We're then going to palpate the TMJ for crepitus, tenderness, and subluxation. So open and close your mouth. Okay. Next, we're going to assess cranial nerve number 5, which is the trigeminal nerve, and this is going to be for motor function and sensory. So we're going to palpate over the masseter muscle, clench your jaws. Okay. And for sensory, we're going to get you to close your eyes. Tell me where I'm touching you.
Forehead, nose, left cheek, right cheek, chin.
All right. Next will be cranial nerve number 7, which is the facial nerve, and this is going to be for symmetry. So get you to smile, frown, raise your eyebrows, puff out your cheeks, purse your lips. All right. Next, we're going to inspect the ears for shape and position. We're going to palpate the pinna and tragus for masses or tenderness. Then we are going to inspect with the otoscope the tympanic membrane and auditory canal. We're going to pull up and back. Okay. Up and back. All right. Next, we're going to assess cranial nerve number 8, which is vestibulocochlear nerve. This is going to be done with 3 hearing tests. First is the whisper test. Tell me what I say.
1, 2, 3. ABC.
All right. Next is the Weber test for lateralization. This will be with the tuning fork. Tell me if you hear this equally on both sides.
Yes.
Okay. Then the third test is going to be the Rene test. So tell me when you stop hearing this.
Now.
Do you still hear it?
Yes.
Okay. Same.
Now.
You still hear it?
Yes.
Okay. That lets us know that air conduction is greater than bone conduction. Next, we're going to move to the eyes. We'll inspect the eyes, the lashes, the brows, and the palpable fissures. We're going to inspect the sclera and conjunctiva. Look up. For color, lesions, or discharge. Then we're going to assess cranial nerve number 2, which is the optic nerve, and this is going to be for visual acuity and peripheral and central vision. So get our Snellen chart for visual acuity. Cover your left eye, read the lowest line.
LTFPH.
Okay, right eye, read lowest line again.
LTFPH.
And both.
LTFPH.
Okay, for central and peripheral vision, cover your left eye. Tell me what number.
1, 2, 1, 2.
Other eye.
1, 2, 1, 2.
All right. Then we will assess cranial nerve number 3, which is the oculomotor nerve, and this is going to be for direct and consensual pupillary response to light. I'm going to shine a light in your eye. Okay. All right. Next, we'll test for accommodation and convergence. So stare at a spot on the wall, look at my pen, follow it in. All right. Then we'll assess cranial nerves numbers 3, 4, and 6, which are the oculomotor, the trochlear, and the abducens. This is going to be for conjugate gaze with extraocular movement. So look at the tip of my pen, follow it with just your eyes. All right. Next, we are going to inspect the eyes with the ophthalmoscope. We're going to look for red reflex and inspect the intraocular structures. All right, so right eye to right eye. All right, left eye to left eye. Okay. We're going to move on to the nose. We're checking that it is midline and straight. We're going to then assess cranial nerve number 1, which is the olfactory nerve, sense of smell. So close your eyes. I'm going to occlude one side. Tell me what you smell.
Perfume.
Okay. And occlude this side. Tell me what you smell.
Fish.
All right. That also lets us know that both sides of the nose are patent. We're then going to palpate the frontal sinuses and the maxillary sinuses. We're then going to move on to the mouth and throat. We're going to inspect the lips, teeth, gums, buccal mucosa, the roof of the mouth, the palate, the tongue, the floor of the mouth, which is under the tongue, the salivary ducts, the posterior pharynx, and tonsils if present. So open your mouth, stick out your tongue, move it left, right, up. All right, tonsils are present and grade 1. We're then going to assess cranial nerves 9 and 10, which are the glossopharyngeal and vagus nerves. This is, we're checking to make sure that the soft palate and the uvula rise symmetrically with phonation. Stick out your tongue, open, say ah.
Ah.
Okay. And then we're going to assess cranial nerve number 12, which is the hypoglossal, and this is going to let us see that the tongue is midline with no fasciculation. So open your mouth, stick out your tongue, move it left, right, up, down. Okay. All right. Next, we will move to the neck. We're going to palpate the trachea, make sure that it is midline. Okay. We're going to palpate the thyroid gland. Swallow. Okay, swallow. We're going to palpate the carotids for pulsations, one at a time. Okay, and then we're going to auscultate the carotids for bruits with the bell of our stethoscope. Take a deep breath and hold it. Okay. Next, we're going to move to the posterior chest. If you'll turn around. First, we're going to inspect for any signs and symptoms of respiratory distress. We're looking for any use of accessory muscles, tripod position, any nasal flaring, any retractions, tachypnea or cyanosis. Then we're going to inspect for symmetry and any obvious deformities. we are going to palpate for symmetrical chest expansion. Take a deep breath. Okay. We're going to palpate for tactile fremitus. Say 99 every time I touch.
99, 99, 99, 99.
All right. We're going to percuss in the intercostal spaces. All right. Then we're going to auscultate in the intercostal spaces. Take a deep breath every time I touch. We're going to make sure we get the right mid and the lower lobes. All right, then we are going to auscultate for egophony. Say E every time I touch.
E, 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 E.
Okay, bronchophony is we'll auscultate for. Say 99 every time I touch.
99, 99, 99, 99, 99, 99, 99.
And for
99.
whisper pectoriloquy, whisper 99. All right, you can turn around and face me. Again, we'll inspect for symmetry and any obvious deformities. We are going to palpate for symmetrical expansion. Take a deep breath. Okay, we're going to palpate for tactile fremitus. 99.
99, 99, 99.
All right, we're going to auscultate again. Take a deep breath. All right, then we're going to auscultate the 5 points of the heart. So first we have the aortic, which is the second intercostal space, the right of the sternal border. We've got pulmonic, which is second intercostal space to the left of the sternal border. We've got Erb's point, which is third intercostal space to the left of the sternal border. Tricuspid, which is fourth intercostal space to the left of the sternal border. And then we've got the mitral, which is fifth intercostal space, left mid-clavicular line. And that was with the diaphragm. We'll listen again with the bell, aortic, pulmonic, Erb's point, tricuspid, mitral. All right, I'm going to let you lay down on the couch. All right, so we'll have the head of the bed at a 30 to 45 degree angle. We're going to assess both sides for jugular vein distension and pulsations. All right, then we are going to assess for any heaves or lifts and palpate for any thrills over the auscultation point. So aortic, pulmonic, Erb's point, tricuspid, and mitral. Then we're going to auscultate again over the 5 points with the diaphragm. So aortic, pulmonic, Erb's point, tricuspid, mitral. And the bell, aortic, pulmonic, Erb's point, tricuspid, mitral. Then we're going to move on to the abdomen. We're going to inspect the abdomen for contours and symmetry. We're going to auscultate for bruits with the bell of our stethoscope over the aorta, the renal arteries, the iliac arteries, and the femoral arteries. All right, then we're going to change back to our diaphragm and we're going to auscultate the 4 quadrants for bowel sounds. So right lower, right upper, left lower. We're then going to percuss for tympany dullness and flatness. All right, then we're going to palpate for any masses or tenderness. and palpate for the liver and the spleen. All right, you can go ahead and sit up back to the stool. Okay, turn and face the wall. We're gonna check for, palpate for CVA tenderness. Tell me if this hurts. Any tenderness?
No.
All right, you can turn back around and face me. We are gonna move on to musculoskeletal. First, we're gonna assess or inspect and palpate the joints of the hands, wrists, elbows, and shoulders for any redness, swelling, deformities, tenderness, crepitus, nodules, and for symmetry. We're gonna palpate for the capillary refill and for radial pulse. All right, next we're gonna do range of motion, check the range of motion of the fingers. So do what I do with my hands. So flexion, extension, hyperextension, abduction, adduction, finger or thumb opposition. Okay, range of motion of the wrist is gonna be flexion, extension, hyperextension, ulnar deviation, radial deviation, and rotation. Range of motion of the elbows is flexion, extension, hyperextension. Okay, and then range of motion of the shoulders is going to be flexion, extension, hyperextension, internal rotation, external rotation, abduction, adduction, and circumduction. Okay, next we are going to check grip strength. So squeeze my fingers. All right, that's 5 out of 5 bilaterally in the hands. We're gonna assess the strength of the biceps and triceps. So do this. Don't let me pull, don't let me push. All right, 5 out of 5. We're gonna assess the strength of the shoulder girdle strength. Put your arms out to the side. All right, don't let me push down, don't let me pull up. All right, that's 5 out of 5 as well. We're also gonna assess cranial nerve number 11, which is accessories. So show your shoulders against my hands. All right. So next we're going to test some cerebellar coordination with 3 movements. We've got finger opposition, do this, back and forth, okay? Hand flip-flop, so do this, back and forth, okay? And then nose to finger, so take your right hand, touch your nose, touch my finger, back and forth. Okay. And then left hand. Okay. All right. Next, we are going to move to stereonosis and graphesthesia. So for stereonosis, close your eyes, hold out your hands. Tell me what object is in this hand.
Remote control.
Okay. And for the other hand, tell me what object.
Cotton ball.
All right. And then we are going to do light sensory touch to the upper and lower extremities. So close your eyes and tell me where I'm touching you.
Right arm, left arm, right leg, left leg.
All right. And we're going to do vibratory sensation. This first is going to be in the proximal ulnar prominences. So tell me if you feel this vibration. Well, here.
Yes.
Okay. Actually, just turn it that way. Do you still feel it?
Yes.
Okay. And then the medial malleolus. Feel?
Yes. Yes.
All right. Next are deep tendon reflexes. First, we're going to do brachioradialis. Okay. All right. Next will be bicep. All right. Tricep. Okay, let that relax. Okay. All right. Patellar. Just get back. All right. Achilles. All right. And Babinski. All right. Next, we're going to move on to the joints of the feet, the ankles, the knees, and the hips. And we're inspecting and palpating again for any redness, swelling, deformity, tenderness, nodules, crepitus, and for symmetry, we're gonna check the capillary refill of the toes and the dorsalis pedis pulse and the posterior tibial. All right, next is gonna be range of motion of the toes. So do what I do with your toes. So flexion, extension, hyperextension, abduction, adduction. And then for your ankles, it's going to be dorsiflexion, plantar flexion, inversion, eversion, and rotation. Next, we'll do the strength of the ankles. So don't let me push down, don't let me push up. That's 5 out of 5 bilaterally. We're going to do strength of the knees. So don't let me push back, don't let me pull out. 5 out of 5 bilaterally. Strength of the hips. Push in, pull out. All right, 5 out of 5 bilaterally. You can go ahead and stand up. We're going to do range of motion of the hips. So we're going to do flexion, extension, hyperextension, circumduction, abduction, adduction, and external rotation, internal rotation, flexion, extension, hyperextension, circumduction, abduction, adduction, external rotation, internal rotation, and then next is the range of motion of the knees. So we're going to do flexion, extension, hyperextension, flexion, extension, hyperextension. All right, and we're going to inspect and palpate the spine next. So face that way, bring forward just a little. All right, we're gonna inspect and palpate for any abnormalities. We're gonna look for normal curvatures, scoliosis, any pain, tenderness, any masses. And then we're gonna assess the range of motion of the lumbar spine. So flexion is lean forward, extension is stand up, hyperextension, lean back, lateral, other side, and then rotation, twist side to side. All right, and for range of motion of the cervical spine, we're going to do flexion, which is lean forward, straight up for extension, lean back for hyperextension, lateral to the side, other side, rotation, left and right. All right, and then we're going to assess for Romberg, test for Romberg. So stand, put your feet close together, hold out your hands with palms up, close your eyes. All right. Now we're going to assess gait, so walk away from me normally. Walk towards me heel to toe. All right. And then hop on your right foot. Okay, hop on left foot. And that concludes our head to toe assessment.